Hi, I'm Nathan Stevens. I'm a PhD researcher at the Association for Dementia Studies. I'm also an informal caregiver for my grandmother who's living with dementia. I'm just going to speak about the Worcestershire Meeting Centres project, which is an effort to scale up a community-based intervention across the county in England. So the meeting centres are a community-based intervention based on the adaptation coping model, which has recently been translated in the UK as the adjust and change model. And essentially what this means is that when you get a diagnosis of dementia, you and your family carer will have to adjust to some changes in your life in order to cope well. And these three areas of adjustment are social, practical, and emotional. And then the Worcestershire project is an attempt to implement 9 meeting centres across a county, funded by local government, just over £500,000, led by the Association for Dementia Studies, 4 rounds of applications reviewed by a multidisciplinary panel in line with the essential features of a meeting centre, and this led to my PhD then looking at the impact of this county-wide approach. So just a little bit of context then. Nearly around 9,000 people live with dementia in the county. By 2038, this will be more close to 15,000, so a real need for this type of intervention. We've got everything from the most deprived to the most affluent areas, and therefore a disparity in outcomes and inequalities that affect the provision of care in the county. And this could have a real impact. Approximately 600 people could benefit from this county-wide approach at any one time. So there's real significant impact. So how did we decide to focus on what we're going to in the evaluation? Well, we looked at what I believe we need to deliver meeting centres to scale, so the implementation, clinical and cost effectiveness. And we know a lot about the implementation. It's got barriers and facilitators model that's been very effective for tracking that across time and space. In terms of clinical effectiveness, it's been proven effective in conventional comparison controlled trials internationally. However, most outcome measures for community-based interventions are not what stakeholders value, including people living with dementia. And then I'm asking the question, have we measured the right things? Also, we know cost effectiveness is unproven and proven not against National Institute of Care Excellence threshold for adoption into the NHS. Because conventional economic analysis fails to capture those wider impacts and value in modern societies. And therefore, I'm asking, how do we capture and measure value? So then essentially what the research is looking to do is to look at what value is created by the Worcestershire Meeting Centres project, for which stakeholders and how. And I'm just going to talk about how we can do that. So social return investment is how we're going to do that. It's a framework for measuring and accounting social value. And social value attempts to ensure the social, economic and environmental outcomes are captured and contribute to reducing inequalities, well-being and resilience of community and society. This is known as sort of the triple bottom line. And there's lots of positives about using social return on investment and using social value principles, because you build real strong definitions of outcomes from the bottom up. You assess the wider impact, that added value I was talking about. Also, social return on investment is an accessible form of quantitative financial accounting. It's also theory-driven. It looks at developing a theory of change for the intervention. You can track these changes across time and space. Also has a limit, such as it shouldn't be seen as a single measure of success, and you need to take the wider evidence into account. It's not generalizable because there's subjectivity and discretion involved. It's also resource heavy and qualitatively quite weak. And you'd use it to build socially relevant outcome framework to maximise the value you're creating in your societies for the people and the communities that these interventions serve. It's quite a structured process to doing a social return on investment evaluation. There's 6 stages, 7 principles, and you have to abide by these principles to ensure you've got a credible report at the end. But I'm not going to talk about this in detail because there's no time. But if you want to ask any questions, I'm happy to answer any based on these stages and principles. And then finally, what I believe we might find out, or what this intervention might create within the county, is it's going to leverage the policy drivers, and it's going to bring different parts of the system together, different levels, to work collaboratively on a shared agenda, and therefore it's going to support integrated care system reform. Also, it's going to embed social value, which is a growing movement in the UK and internationally. It's recently been adopted by the NHS. There's legislation to ensure commissioners consider social value, so that's really important. It's going to consider the public health perspective, so it's not just going to look at health, it's going to look at wider social and economic impacts on a much broader level. It's also going to give us some sort of value for money equation. It's going to tell us about the cost effectiveness of meeting centres, which is crucial to share with investors, funders and commissioners. But most importantly, it's going to go to local people and communities and say, what's important to you? What would you like us to measure? How would you like us to build meeting centres around the outcomes that are most important to you? And by doing this, it's going to show that the system is working for people and communities, because too often it just doesn't. And that's all I'm going to share with you, and I'd welcome any questions. Thanks for listening.